This is a self-rant. I'm not really planning on showing anyone, but it's just something I have to say. I can talk to myself as much as anything else. God, bear with me because it is the end of a 14-hour day, so if I start to ramble, I apologize. Something that really bothers me is the quality of life we are okay with people maintaining. And that's really vague. It doesn't really address anything in specific. That could be any other country. That could be anywhere. My focus is actually right here in the U.S. about nursing homes. I'm a nurse in the greater Kansas City area, and I have worked in the last year at probably 10 to 20 different locations, all licensed LTC, that's long-term care facilities, which are reviewed by the state, they are held to standards, etc., etc. And it doesn't matter if I'm in the richest part of Kansas City or if I'm in what some would call the ghetto. They all have the exact same flaws. So, looking at it just on the surface, you've got a facility where a small one is 45 beds. That's a really small facility. In Kansas City, there are several that I've worked at that are 200 or 300 beds, I believe. And in these facilities, you have really poor living conditions. We'll say, well, Derek, everyone knows that. Everyone knows nursing homes suck. Yeah, but you don't know. You really don't. Let me tell you what you don't know. What you don't know is that you have patient to staff ratios of 40 to 1 for a nurse. That's right. I have worked in patient to staff ratios where I have personally had to pass meds, assess, take care of 40 plus patients by myself. I don't care how good a nurse you are. I don't care where you went to school. I don't care how efficient you are. There isn't time in the day. People deserve more than that. Basic human right says you deserve more attention than what I can provide to you if there are 41 other people I have to see. But it gets better. So, let's just put it at 40 for a number's sake. And each person genuinely has medication passes at 8 a.m., noon, and 5. So that's 3 medication passes per person, 40 people. That's 120 med passes. If I am fast and I don't ask questions, I show up, I give them the meds, I make sure they swallow them, they are still breathing, and I leave the room, by the time I get the meds together, get in the room and get back to my cart to start the next one, it's probably been at least 5 minutes. Off the top of my head, I can't tell you what 120 times 5 is. It's 520 and 5 is another 600. That's 600 minutes, which is 10 hours, I think. Sorry if my math's off. Once again, see earlier, where I was 14. I'm 14 hours into the workday. So that's 10 hours. So my whole shift is only 12 hours long. So that means if I did just 5 minutes with each patient, assuming my math's right, which is probably not, just 5 minutes, that means your loved one, who you are paying through the nose, which I'll get to be there, only sees a licensed nurse to take care of their health, which is probably in dire straits because they're at a nursing home, for 5 minutes a day. Well, that's times 3, sorry. So 15 minutes, because I'm seeing them 3 times. So 15 minutes is all they're getting in an entire day. In a 12-hour period. 15 minutes of attention. So, and that's just medications. That's nothing else. That's not me taking anyone to the bathroom. That's not me dressing anyone's wounds because they're not being turned. And believe me, there are a lot of people who have wounds because they can't be turned. But why can't they be turned? Well, because they're at staffing ratios of 40 to 1. And if I'm in there turning every patient, that's an extra 5 minutes. I don't have 5 minutes to spare. I have meds to pass. Well, are the meds more important than turning them so they don't get sores? For some people they are. So for some people they will be life or death, because it could kill them if they don't get their medications. I'm on a tangent, sorry. So, that only leaves me with 2 hours, as we did math earlier, to do all of the other treatments, which is breathing treatments, turning, repositioning, helping people eat, helping people go to the bathroom, changing people who have gone to the bathroom on themselves, spending time with them at all. 2 hours. That's all it gives me. Well, you might say, but Derek, you have AIDS. You're right. I do have AIDS. And when I say I have AIDS, it means I have a poor, bless her soul aide, and I say her, there are men, bless her soul aide, who has 60 people between her and someone else. And her job, yes, that's her job, to turn, to bathe, to reposition, to clean up, and to mobilize. Her job. And that is all her job is. Have you ever tried to reposition someone who is hypertonic, flexed because of their disease process? Or reposition someone who's 300 pounds and the only way they can ambulate is a Hoyer lift, which requires 2 people to run appropriately, if not more, if they weigh too much? I promise you, even if you're good at it, it's going to take you 5, 10. If you have to Hoyer someone, it could eat to get them back to bed, changed, and back into the chair, because no one deserves to lay in bed all day. It's going to take you at least 5 to 10 minutes, maybe more. And I'm being generous. At least I feel like I'm being generous. So, once again, we run into the issue of, I don't have time to keep you clean, changed, repositioned, ambulated, fed, interacted with fellow peers, because if I spend 15 minutes in Susie's room, that takes 5 minutes extra that I didn't have from Bobby, who is now sitting in his own bowel movement, which he had, or hasn't been turned in 3 hours because he was patient 42, because someone has to be last. It's like, they have to see someone last. And unfortunately, the time it takes to get to that last person is sometimes 3-4 hours. And the family members are mad, and you have every right to be mad. Every right. I would be furious, because they come in and they're like, they're in the same clothes they were in 3 days ago. That means they haven't had a bath in 3 days? That's exactly what that means. That is exactly what that means. I would say over half the people in the nursing home are incontinent. That means if they're in the same clothes, there's a good chance there's probably BM or urine on those clothes they've been wearing for 3 days. You think about that for a minute. How gross that is. And it's not because we're spiteful. It's not because we hate these people. It's because they're worked to the bone. And I'm not even a full-time nursing home nurse. I'm just extra. I step in to help on the side because I was trying to make some extra money and discovered this whole situation. So we now have the family who's upset because their loved ones aren't being changed or taken care of. They're getting worse, not better, or even staying the same. They're declining at a rapid rate. Well, and to top it all off, the average cost, this is a statistic from U.S. Department of Health, I believe. I don't have a link, obviously, right with me right now. The average cost of a semi-private room in a nursing home is like $221 a day. Are you kidding me? That's like $81,000 a year. That's more than I think like 50% of the United States makes a year. And that's what it costs for a person to be in a semi-private room. Obviously, these numbers could be off if the statistic is not accurate, but you understand my point. They're not that far off. I've seen the bills. And that they're paying that kind of money that any American would be damn happy to be making every day, to be taken care of to that quality. So, you have a lot to say about this, Derek, and a lot to complain about, but I don't hear any solutions. You're right. Someone who complains and throws a fit and doesn't present a solution to fix said problem is only part of the problem. So what's the solution, Derek? Well, I can tell you that the average nursing salary in Kansas City right now is between $40,000 and $55,000. That's based upon what I know my peers are making, not based upon any statistical average or fact that I have on hand. So, what that means is you could almost hire 2 nurses to work full time to take care of your loved one for the price that you pay for them to be in that facility. Now, I'm sure there are Medicaid and Medicare and all of these insurance companies that pay for old people to be in these homes, which in turn kicks the buck up, and so it's not straight the family paying out the $200 a day or whatever it is. But you're going to tell me you couldn't set up an organization to take care of people in different settings? That's one of my suggestions, is hire your own nurse. Seriously, you'll pay him or her better than she's ever going to make in a hospital starting out, and they'll have one-on-one care where they are actually taken care of. They actually spend time with people. They do things. They don't just sit and stare at the wall for 6 hours a day. Another option, and this is probably the better option and the more realistic, initiate laws. Make this illegal. Not nursing homes in general. I understand why they exist. People don't want to take care, the people, they can't afford or don't have the time to take care of elderly. That's fine. I understand. I have a busy life. I get it. But instigate regulation, and I'm talking actual law. It is against the law to have more than, I hate to put a number on it off the top of my head because I'm going to hear about it later, 15 to 1, 10, 12 to 1. Think about this. My wife takes care of infants or small children from the ages of 6 weeks to a year old. These children are much like these adults that I take care of that just don't require medication. They can't go to feed themselves very well, if at all. They can't bathe themselves very well, if at all. They can't move around safely very well, if at all. And it's only legal for my wife to take care of 4 infants by herself. 4. But we're okay with 1 nurse taking care of 40 people. 10 times. 10 times. How can we be okay with this? I think about my grandma and all the times that she picked me up from school when I was sick, or she brought me things, or my grandma was really involved in my upbringing because my mom was a single mom who worked 2 jobs. She was busy. And I love my grandmother. And if I ever walked in on the situation that's going on in our nursing homes across, I can't say across the United States, that's not fair. Where I live, I doubt is an anomaly. I doubt it. I very seriously doubt it. If I walked in on the situation where my loved one was being taken care of the way these people are being taken care of, I would physically remove her from the situation to prevent myself from doing something that would be ridiculous. How can you claim to love these people and to care for their well-being and to put them in these situations? I could literally go on for hours about this, but just think about that. Think about your grandparents if they're in a nursing home right now. Think about the last time you went and seen them. Think about the last time when you go in there, think about what it smells like when you walk in the door. When you walk in the door, do you hit with that odor of BM or urine? Do their clothes smell old, unwashed, or do they look a little disheveled? I don't know. I don't know about you guys. I can't let it happen.